Good afternoon. Everybody knows, I think, I hope. Patrick Murphy is the Commissioner of Dishes, to my far right. Commissioner and Dr. Howard Zucker, Commissioner of Health. Melissa DeRosa, Secretary to the Governor, and Robert Mejica, Budget Director. Thank you all for being here. Bernadette Hogan is still upset with me about St. Patrick's Day. We did not cancel St. Patrick's Day. It was postponed. Postponed. And by the way, His Eminence agreed with me. Columbus Day, crowd is smaller. Okay, let's talk about this today. We are talking about a public health emergency, and we're talking about setting up a public health emergency system, right? So much of this information is episodic. We're doing this here, we're doing this here, we're doing this here. This has to be a system that is in balance and can handle the entirety of a public health emergency. So there's two basic functions you're performing. One is reduce the spread of the disease. Two, make sure that you can treat the number of people who get infected, right? So reduce the spread the best you can. You do that through testing. You do that through density reduction, reduce the spread. Second half of the equation, you must be able to treat the number of people who do get infected, and you need a hospital system, a healthcare system that can do that, okay? So that's what we're working on. On reducing the spread, it's testing, and then it's density reduction. On testing, I'm not that interested in what happened yesterday and what we should have done a few months ago. I'm a governor. I'm more interested in what's happening today and what's going to happen tomorrow. There'll be plenty of time to do a retrospective. We need to increase testing as quickly as possible and get the volume as high as possible. The more people you test, the more people you can isolate. Testing is not about figuring out how many people have the disease. That is gone. As far as I'm concerned, we are way behind in testing, determining how many people are actually infected. The state has authorized 28 labs within the state to conduct testing. That will dramatically increase the number of tests we can take. The state is contracting with a national lab that is supposed to be getting FDA approval to do what's called automated testing, which could increase our capacity by the thousands. We could actually be up to about 5,000 per day next week if the FDA approval works and everything works. But the most relevant data from our point of view is the hospitalization rate, okay? The testing is not about what percent of the population has coronavirus. You will never figure that out today. The testing is about what percent of those infected are hospitalized to determine the capacity we need in our hospital system. The second way you reduce the spread besides testing is reduce the density of people. We all talked about how it's contagious, touching surfaces, et cetera. Reduce the density. So we're going to take very dramatic actions in that regard. To reduce the number of people in contagious environment, no gathering with 500 people or more. From 0 to 500, we're reducing the occupancy by 50%. So 50% of your seated capacity is the new capacity for a facility. Those new rules will go into effect 5 o'clock on Friday, except for the Broadway theaters in Manhattan, where it will go into effect 5 o'clock today. Yes, that's only several hours, but we've already been talking to the Broadway theaters, and they are aware that we're going to be doing this. so they have notice. These rules don't apply to schools, hospital, nursing homes, mass transit facilities. In addition, this is assuming that businesses are following the protocols that we put out about diligent cleaning requirements, et cetera. Any business that can't maintain their current occupancy or these new occupancy rules with that diligent cleaning, they should contact Empire State Development, and Empire State Development will give them what's called a close order, direct them to close. That's important for businesses for legal reasons. And their phone number for ESD is 212-803-3100. So that's on the reducing the spread. More aggressive testing, which we are doing, and then new density reduction guidelines. That then has to work and be coordinated with the capacity to treat the number of infected people. When you look at what happened in Italy, where did they get into trouble? You overwhelm the healthcare system. And that's where you can get into trouble. If the number of people infected who go to a hospital cannot be treated at the hospital. That's what you want to plan for now. So first of all, most people who contract the virus will self-resolve or be treated at home. That's about 80% of the people. For the remainder, 20%, we've talked about the vulnerable populations, et cetera, you need hospital capacity to handle that number. What is that number? Well, that's why we're watching the hospitalization rate on those we test. So even if you don't have a testing sample that tells you what you have in the population, you have a testing sample that tells you what % of those people being infected are requiring hospitalization. And from that, you can factor a hospitalization rate. And that's what we're doing. We're working with the hospitals across the state to develop what's called a surge capacity. How do you expand the capacity in the existing hospital system besides just filling vacant beds? And there are a number of strategies to do that. First of all, we're not doing it today, but the healthcare system should be on notice that we might cancel at one point elective surgeries. Elective surgeries are about 25 to 35% of the hospital beds, believe it or not. So if you cancel elective surgeries, you free up a significant amount of hospital space. And again, we're not doing that now, but it is something that we are considering in our back pocket. Department of Health is accelerating regulations to get more nurses and personnel trained and put into different positions. There are different tranches of certification. Department of Health is working to get people into positions where they can work, for example, in an ICU unit. We're asking former doctors and nurses to reconnect with your old hospital, your old healthcare employer, to be on an on-call basis. When you're talking about hospital systems, you're talking about two components. You're talking about the facility capacity, and then you're talking about the staffing capacity. One of the things that has happened in China, South Korea, and Italy, if you study those models, healthcare workers get sick, and they can't come to work. So making sure you have enough staff and reserve staff is just as important as making sure you have enough facilities. So we're asking former doctors and nurses, contact your previous employer. Department of Health will accelerate your recertification on an emergency basis. So if we need you, we'll have a reserve workforce. National Guard has a number of medics and medically trained personnel and EMTs. We are now identifying them and identifying them for a reserve staffing capacity also. Medical schools we're contacting, again, for the same reason. to identify possible reserve healthcare professionals who we could call from a medical school if we wind up in a staffing shortage. This is all if, but that's why it's planning. Plan for every contingency now. Hopefully, you don't have to do any of it. We're also looking at temporary hospital facilities, what facilities the state owns, what facilities the state has, that if we need actual physical space, we could actually expand the healthcare system by identifying temporary hospital facilities now, and coordinating the upstate and the downstate hospitals. We have more vacancy rates in upstate hospitals, so we want to plan the health system as one health system and coordinate upstate, downstate. Worst case scenario, if you run out of capacity downstate, you have upstate capacity. But that is the second part of the system, right? So first part is assess the number of people who are infected. That's the testing. Reduce it. That's the reducing the density. Second part of the equation, make sure you can treat those people who are going to need hospitalization, because you have both the facilities and you have the staff to work those facilities. The system calibrates to the most recent data. So we're watching that hospitalization rate to gauge, to plan what could be the possible hospitalization rate for our population. We're studying the hospitalization rate in China, South Korea, Italy, et cetera, to gauge what we need to be prepared for in what could be a matter of weeks. Special concern has always been nursing homes and senior assisted facilities. Why? Because they are the vulnerable population, right? We've always said 80% self-resolve, 20% might need medical attention. The lethality rate is among the vulnerable population, senior citizens, people with compromised immune systems, people with underlying illnesses, especially respiratory illnesses. So nursing homes have always been of special concern. The tragedy in Washington State, the number of deaths, that's a nursing home. We're putting additional requirements on nursing homes. All staff must wear masks. All staff must be monitored for symptoms as they're coming in. No non-medical staff personnel to enter a nursing home. This means no visitors in a nursing home, which sounds very difficult. But look, you don't need, if you care about someone in a nursing home, the last thing you want is to endanger that person. And a visitor, a grandchild going to visit his or her grandmother who walks in the virus, you're not doing anyone a service. We'll leave it up to the facilities if they are what's called exigent circumstances. If a person is in a dire situation, then certainly let them see their family. In that case, the family should wear protective equipment, et cetera, if they're going into the facility. And we'll leave that up to the discretion of the facility. We have several districts across the state that close. You will see this happening every day. Remember, we have a state regulation that says any school that has a child who tests positive must close for 24 hours. That school is then cleaned for 24 hours. After the 24-hour period, we make an assessment as to whether or not that school should reopen, if so, when. This is primarily a local decision, and some school districts are making that decision given the facts and circumstances. For example, in Nassau, we have the Plainview Old Bethpage Central School District that's closing for 2 weeks. A couple of basic points. Number one, science dictates these decisions. I am not a trained medical professional. although I'm getting a heck of an education on an ad hoc basis, I may apply for some certificate or something soon. But this is about science, this is about data, and let the science and let the data make the decisions. We're blessed to have Dr. Zucker, who is literally one of the finest in the country, guiding this effort and giving us his advice, and we're following his advice, and that's the way this should be done. This is an evolving situation. The numbers change every day. The facts change every day. That's fine. As the facts change your response. And that's what we're doing, and you can calibrate up or you can calibrate down. I've been in consultation with all of the elected officials, not all, but many elected officials in the state of New York talking about this. I spoke to Speaker Carl Hastie this morning about this. I spoke to Senate Leader Andrea Stewart-Cousins. Mayor de Blasio and I agree on these recommendations. I've spoken with other mayors. I've spoken several times with Vice President Mike Pence, who is the point person for the federal government. A big part of this testing is getting FDA to approve certain things. And the Vice President has been very cooperative and has made an effort to facilitate New York going to these private labs, these 28 private labs. So he has been very helpful to us. We're also working with the private sector on these closings, the 500 and the 250. We did that speaking with business leaders across the state, specifically, for example, Association for a Better New York, partnership, and chambers of commerce across the state, and I want to thank them very much for their help. The most recent numbers, you see the state is up to 328 cases, 112 new cases. So you can see the numbers are increasing. Again, that is not representative of the percentage of the population that has coronavirus, because we don't have the testing capacity to actually determine that. This is testing where we're tracking positive cases so we can isolate them. There are several new counties, Albany, Broome, Delaware, Dutchess, Herkimer, and Monroe, now have cases today. They didn't prior to today. You can see again, New York is up at the top of the list nationwide with the state of Washington. Again, state of Washington has 29 deaths. Up until this point, we've not had any deaths. But again, that's the nursing home nightmare, if you will, what happened in Washington. And that's why we're taking special precautions here. 47 out of 328 cases hospitalized, 14% of the cases hospitalized. To me, that's the most important number. Again, what happens if you get the virus? 80% self-resolve, et cetera. We need to make sure the healthcare system has the capacity. That is the intelligent priority for any government that is planning right now. That's, again, the issue in Italy. The healthcare system couldn't handle the number of infected people. And then you can say, yes, you will recover with the right healthcare, but you have to have the right healthcare. And that means the healthcare system has to be responsive to whatever number is generated. Again, put this all in focus. I know the hysteria is high. I know the political environment superheats everything. But when people say, how bad is this? Which people say to me 10 times a day, how bad is this? Johns Hopkins has tracked every case of coronavirus since it started, every case. 127,000, 4,000 fatalities. 68,000 of the 127,000 have recovered and 54,000 are pending. Those are the facts. Those are the numbers. Well, this one thinks this one opinion. Yeah, opinion. These are the facts, and these are the numbers. It is worse than the flu in terms of the numbers, yes. We don't want to lose anyone, that's unfortunate. But it's more being able to handle this situation governmentally, operationally, being able to make it all work. And that's what we're planning on right now. Questions, comments?
The capacities you have for testing right now by the labs, also the number of tests, if you have, that have been done, and the number of people who are currently under some kind of quarantine?
So we have done, as of 12:40 this afternoon, 2,314 tests.
That's people or tests?
Those are tests.
How many people that is?
Well, it's two tests per person, so nose and mouth.
And then quarantine figures at all?
The people being self-monitored is still in the thousands. I don't have the exact number.
About 2,000.
About 2,000 quarantine statewide?
Yeah.
It was 4, wasn't it?
Yeah, it drops. You're only on quarantine for 2 weeks, and then you're out of quarantine.
Can you give us a list of the labs that are currently running tests?
I'm sorry, it was people who were tested. It's the number of people who were
So
tested.
2314 is people?
Yes.
Yes.
So double that amount of tests that have been run, since each person gets 2 swabs?
It's 4,628 tests, 2,314 people. So.
Yeah, let me just, because we go back and forth with this testing. The federal government will talk about testing kits. A testing kit are the swabs that are used. There's an abundance of testing kits. There's not enough tests. Well, how can that be? You just said testing kits. The testing kit is the swab. The swab then gets sent to a laboratory. The laboratory has to have the capacity to then perform the test. That's where we have issues, the number of labs that can perform the tests. And do they have to do the test manually, or what they call semi-automated or fully automated, which gives you the highest throughput. But the testing kits are only the swabs. Why don't you say it?
Test, how quickly can someone get the results on a test?
Within hours, we can run the test. Once it gets here, it only takes a matter of hours, and then we get it back.
But given that there, aren't enough labs at this point, is there a little bit of a delay? We've heard some people were tested and then 2 days later found out they were positive, obviously quarantining that time, but who knows what else could have been done.
As the tests come up, we can run 96, they're in little gels, and you can run them, and then the next batch comes in, we put those on, and the next, it just keeps going every hour.
Could be hours, but could it be longer than that? What's the longest amount of time, I suppose?
Well, every day, if someone has a test done, that day the results will come back.
The other thing that it's important to remember is that some of the tests now are going to Quest and LabCorp, which are not in New York, so they have to ship those samples to be tested, and that creates a lag.
Is there ever going to be a point in the foreseeable future in which anyone who wants a test can just go into a health center or go to their doctor and get one?
I don't see it.
Has the criteria to get
I mean,
the
think
test
what you would
changed?
need, Nick. You would need, if you put up a sign today that said anyone who wanted to be tested can be tested, with this fear and this anxiety, you have 18 million people in this state. How many people would go be tested? If I said in this room, how many people want to have the coronavirus test because you can get it, and it's no cost, by the way, in the state of New York, half the room would say yes.
Governor, on Broadway, so all Broadway theaters have more than 500 seats, so effectively this will close that industry.
Yes, sir.
And if you have a theater or a meeting space or a gathering space under 500, then you need to reduce that by half.
50% of the occupancy of that
The
facility.
occupancy, listed occupancy.
Yes.
But
So-
basically, this will close Broadway.
Yes, sir.
down. And have you spoken to Actors Equity or the other theatrical unions about the impact on
We
this?
have spoken to the Theater Association. Who
We've
was it?
spoken to the heads of all of the different theaters. Robert and I did extensively, and they agree with this 100%.
And Rob, just, have you guys looked at what the economic impact of this sort of action might be?
I mean, it's changing on a daily basis, so we're looking at it, right? The markets are reacting to it, so we're looking at it. We don't have anything.
Say in terms of
It all depends on how long, right? It depends on how long, right, this continues. So we're looking at it right now. We don't see an impact like in this budget, but we're spending, right, at a fairly fast clip, right, on money going forward, and we're just spending the money that we need to. But as far as the economic impact, it's going to take some time.
So with that closure on Broadway, how are you going to evaluate that every day?
Yeah,
every
but
3
Joe,
days?
Jesse, forget the closure on Broadway. The loss of revenue here to the state government right now is incalculable. I mean, you have no idea. It's not just Broadway theaters. I mean, you have hotel cancellations, you have conference cancellations, you have people not going to work. That stock market drop alone, what that means to this state's revenues. You cannot calculate it, and then you'd have to, well, guess, when is the market going to come back? When does coronavirus clear? When do the hotel rooms relist? You know, so you don't know. I can tell you this, it is going to, I don't see any possibility of states being able to handle this on their budget without federal action. What is our unemployment insurance cost? What is that going to go to? You know, who knows?
I just wanted to follow up on the ban of over 500. How often are you going to evaluate that? It's like, you know, you didn't say it was going to be for 2 weeks or anything. I mean, how
Daily.
often- Daily?
We'll see. We'll watch, look, we watch this 24 hours a day, right? As the numbers change, I can't tell you anything more than the numbers tell me. I see those numbers going up on the number of cases, on the hospitalization rate. I see that going up. I adjust to the numbers. Commissioner of Health adjusts to the numbers. You tell me when those numbers turn, or when we turn those numbers. Remember, China, South Korea turned the numbers. It wasn't that they waited for the virus to exhaust itself and burn itself out. They turned the numbers. You tell me when we turn the numbers, your guess is as good as mine, but we will calibrate it to whatever it is. I'm looking at that hospitalization rate. We want to make sure that we can handle that hospitalization rate, whatever happens to the denominator. I believe, and I've said from day one, these tests were very deceptive because we never had the testing capacity to have a valid sample. And to say, well, there's only 300 cases in the state of New York. No, that's not what it's saying. If it was 10 times that, I would not be surprised. So I'm looking at the hospitalization rate.
So what happens to the state capitol during the occupancy reduction? You have 213 legislators plus their staff on a legislative session day. You can easily get to more than 500 people in this building.
Yeah, I think we're probably at 50% occupancy. We exempted government buildings.
What are you going to do with the Capitol? No, I was going to say, what are you going to do with the Capitol? I mean, it's obviously a large gathering place, regardless of the numbers. Are you concerned about people coming in and out of this building as you get
Well,
into the
we're
budget?
considering what the Congress did, which is banning visitors. That's something we're looking at, but we haven't made any decision.
The occupancy of the 0 to 500 reduced by 50%, will that cover houses of worship as well?
Yes.
And then-
Just to follow up on that, you know, sporting events are being canceled, parades are being canceled, people are.
Postponed. St. Patrick's Day was postponed.
Postponed.
Hogan is
But
sitting
people
right
are-
next to you.
people are
She'll
going
hit
to
you
the
with
grocery
her
store
laptop.
And they're buying food, they're buying toilet paper. What's your message to New Yorkers about how things are seeming to change very rapidly right now? What do you say to people who see that things are changing?
Nick, the perception is changing. The reality hasn't changed. I mean, we have been talking, I've said the same thing to you every day for the past 3 weeks, I think. You're going to see these numbers go up. You had to. You saw last November, you saw China, and you saw the numbers increasing in China in November and December. You know what this virus does. You knew someone was going to get on a plane in China and come here. That was not a leap. So you know the spread, you know the numbers, you know what they had to do to change the trajectory of those numbers. You know the close downs that they had to do, the measures they had to take. You know how many tests they were taking. What makes you think that the virus in China or the virus in South Korea or the virus in Italy was going to react any differently than the virus here? This was always going to happen. And that's why I said, you're looking at these testing numbers. The testing numbers mean nothing. You are going to see the same trajectory that you saw in China and South Korea and Italy, and it is going to happen here as the virus spreads because of the way it actually is contagious. And the only question is, are you gearing up to handle that? Are you doing enough testing so you're isolating the positives and slowing down the spread? Are you doing the density reduction to reduce the spread? And then can you handle the hospitalization number that's going to result from that infection rate?
How long are the density rules in effect?
For the foreseeable futures until it changes, Jesse.
There's no end date at this point?
There's no end date. It will be calibrated to the spread of the virus and the treatment of the virus. Obviously, we all want to get back to work as soon as possible. So as soon as we can go back to normal, we'll go back to normal. But we are still ascending, right? We are still on the upward trajectory of this disease. No one that I know, I speak to national health experts all day long. More importantly, Commissioner Zucker talks to them all day long. I don't think anyone has said, you have seen that line start to turn. All you see is that line still going up. So this is going to get much worse before it gets better. That was always the fact. That was always the necessary numerical conclusion to this. When I kept saying it's math, look at the spread, it's math. It has to get worse.
If there's any finite amount of testing capacity at the moment, at what point should people go to the ER or to the primary care physician to seek assistance or help, so not to overwhelm?
So they should call. I've had personally people call me who have asked me that exact question, and I've said you should call ahead to your doctor, discuss your symptoms with them, and let them guide you in the right direction. And then if you go to the emergency room, your doctor should call ahead to let them know that you're headed there.
But should they be monitoring themselves if they have a fever for more than a certain number of days, or if they have respiratory issues?
I think that's a clinical judgment because every patient's a little bit different. Some people may have underlying medical conditions, and you should adjust it accordingly.
On the new 500 rule, who's enforcing this and what are the penalties if it's broken? Do you want me to take this?
Please.
So there's going to be a range of penalties. It can be fines or it can just be getting shut down. So businesses who aren't adhering to it could be shut down. That's the most dramatic point, obviously, and we don't anticipate people are going to do that. Actually, all the businesses we've been communicating with were eager for clear guidance on how to operate in a safe, healthy way, or you can be served fines. And we're going to work with the locals to the enforcement on the local level.
Large office buildings, you're talking about venues with 500 plus.
But we have not had, and this is sort of remarkable, and it's a beautiful thing to say about New Yorkers, we have not had a legal situation on any of these things that we've done, right? There's never been, in all these measures, quarantine, all these things we've done, no one has ever said, I refuse, I resist, and brought it to a head. And I don't believe, we've done this in consultation with all the businesses because, look, everybody has the same interest here. Everybody wants to make sure we get through this and we get through this as easily as possible. Go ahead, I'm sorry.
Governor, on the measures that you're taking to increase hospitalization rate, how many beds have you increased, or what is the goal for this?
Well, that's what we're watching, right? That's what we're watching. What's going to happen, right? Well, these are the numbers we look at, right? You watch the number of cases that are going up, and then you watch the hospitalization rate. And that's what you want to be prepared for. How high is that number going? How quickly? And what is the hospitalization rate on that number? And then when we say what's going to happen, what's the bottom line? This is what's going to happen. This is what was always going to happen. Those numbers are the numbers from China, South Korea, Italy. That's what's going to happen. Those proportions will happen here.
So what's the proportion here?
whatever the hospitalization rate was and the growth rate. You don't know the denominator because you don't know how good you are at stopping the spread. How quickly do we come up to speed on testing? How successful are we on density reduction?
But I'm not asking you to project what it's gonna be. I'm asking, what's your capacity increase to, under all these measures?
Well, the elective surgery alone, depends on the hospital, is 25 to 35% of additional capacity. In other words, 25 to 35% of the hospital beds are now elective surgery. Is that the term, elective surgery? Because I don't really have my full degree yet. 25 to 35% are elective surgery. Just stopping elective surgery adds 25 to 35%. So you then have the facility question. I think one of the outliers here and what happened in Italy is the staffing more than it is the facilities. Healthcare workers get sick. And what is the backup for sick healthcare workers? And that's why we're taking these extraordinary measures, past nurses, past doctors, National Guard, medical personnel from a medical school. So you have the facility capacity, staffing capacity. I frankly think the staffing capacity, if anything, is going to be more of a problem than the facility capacity.
What is that, 25 to 30%?
Electives.
Number of beds that would be increased?
You want to do that, Don?
So elective surgery can either be outpatient or inpatient surgery, right? So it's a reflection of the entire healthcare system. You would have, if you don't do elective surgeries, the physicians, the nurses, everyone's involved would be able to redirect their energies towards the patients who would be in with coronavirus.
But how many beds are we talking about? How much capacity is increased?
Well, I have to give you an exact number, but it is a significant, I can't give you exact percentage, but it's a significant percentage.
Business loans, have you made any more progress on business loans where businesses are not only losing business, but also employees?
That's going to have to be done on a federal level. This state is not going to be able to compensate businesses for lost revenue. It would bankrupt the state.
Does quarantining apply to large office buildings? Does it, you mentioned Broadway, obviously, does it apply to?
It's congregate spaces. So large office buildings, you don't have 500 people in one room, right? People are in their own individual offices. This is about, remember, it's about social distancing. It's about staying 6 feet away from people. It's not putting people in where you're massively packed into a space. So unless you have an office space where it's an open bullpen with 500-person occupancy, it doesn't apply to you.
Broadway League says it's gonna reopen on,
It's concentration, it's density, it's proximity.
the Broadway League says it's gonna reopen on April 13th. Is that accurate to what you're understanding?
They're closed until we reopen.
We'll see.
How many labs are currently online?
Wait, I'm sorry, go ahead.
Thank you. So the known cases, should we be quarantining them at home with their families or separating them and putting them in separate facilities?
Just restate the question.
Known cases that we have confirmed
There-
cases, should we be quarantining them at home with their families or separating?
So they are, if somebody is at home who is positive, then their relatives who are negative are away from those individuals who are positive, separated.
Who didn't ask a question yet? You're behind the camera, you don't get the rest of the question. All right, that's the rule. The rule is if you're behind the camera, you can't ask a question. Okay, go ahead.
When you talk to the speaker in the,
So much for the rules, right?
when you talk to the speaker in the majority leader, is there any discussion on delaying the budget?
Nope. Because we've got now, the budget. The budget director, the budget had a revenue, the budget's premised on a revenue projection, right? What's the first number in the budget? It's the revenue projection. The revenue projection was based on a reality 60 days ago that no longer exists. That's why I asked the controller for his opinion. And by the way, I asked the controller for his opinion on a revenue estimate last week. Since then, reality has changed 11 times. You look at that stock market, you tell me what the revenues are going to be. So we have to do a budget. you have to now come up with an estimate on revenue projection. Your expenses have also changed dramatically. You tell me what our unemployment insurance cost is going to be. We did an unemployment insurance cost estimate before any of this. How many people are going to be unemployed when these businesses in the supply chain, how many people are going to be unemployed when their business says, don't come in, we're not operating? So it makes the budget process much more difficult. Because in truth, nobody can tell you. Nobody can tell you what that revenue projection is going to be. Nobody can tell you what the costs are going to be. And nobody can tell you what the federal government is going to do in response. You know, is the federal government going to pay the insurance cost, the unemployment insurance cost? Is the federal government going to reimburse states for their health care costs? You know, who knows?
Can you just talk a little bit about, obviously you want to get as few people together as possible. Schools and mass transit systems, they seem to be like the last resort. So can you talk about your thinking with both of them?
Yes, schools are obviously primarily young people. And young people, knock for Micah, do not seem affected by this virus the way older people are. Also, the schools, you close schools en masse. Now you have to find out, you know, that's tremendously disruptive to all of society, because now how does somebody go to work if their kids are going to be home? So that's a problem there. On the mass transit, first of all, the ridership is down on mass transit all across the board. So the density has come down naturally. You want to make that point?
In schools, it's something that we talked about, obviously, all the things the governor said would be so disruptive, but additionally, again, it's 40 kids in a classroom at the maximum. So what we're talking about is congregate spaces where you're packing a tremendous amount of people in. So you're talking about 40 kids. And on mass transit, just to punctuate the governor's point, we're seeing that sort of self-correct on its own. Subway ridership is down 18.5%, buses are down 15%, Metro North is down 48%, Long Island Railroad is down 31%, and the bridges and tunnels we're actually even seeing are down 7%.
Let me just say this. Perspective is so important here, just a factual perspective, because the anxiety, the fear is not connected to the facts, and the anxiety and the fear can be more disruptive than the facts. Those numbers are the facts. They are the indisputable facts. With 127,000 cases as the database nationwide, those are the facts. They're not, you don't want to see anyone pass away, but those are the facts. The question now is, how do you reduce the number from past experience by reducing the spread, more testing, more density reduction, and make sure you have the hospital capacity so you can save as many lives in the hospitals as possible. That's all this is. And this is very manageable. This is very manageable. I went through Ebola. Ebola was frightening. That was frightening. That was, frankly, what the mindset is, closer to what the mindset among the public is. Ebola was very, very, very hard to cure. And if you got Ebola, you were in a serious situation. That is not the case here. That's not what the numbers say. It's not what the data says. It's not what has happened anywhere else on the globe. This is about having the system in place to manage it. Well, we didn't have the testing in place. You're right. You're right. I think that's caused anxiety for people all day long on the TV. It's we don't have enough tests, we don't have enough tests, we don't have enough tests. First of all, the tests are basically irrelevant at this point, right? You're not going to find a sample of how many people actually have the disease with the tests. That horse is out of the barn. What you're doing is identifying people who are positive so you can isolate them. That's what the tests are doing. But the tests and what we did 3 months ago, that is yesterday. What do we have to do today? What do we have to do tomorrow? Plan this emergency health management system. More testing, reduce the density, have the hospitals ready. That's what we have to do. Let's focus on what we have to do, and let's keep the anxiety to a realistic level to the extent we can. I'm sorry. Thank you very much. I have to go to work.